Good afternoon, and welcome to the Beyond the Blueprint webinar series. This series was designed to empower health IT professionals with the latest insights and strategies for integrating digital tools seamlessly within your projects. Whether you're embarking on a hospital remodel, constructing a brand new facility, or undertaking a targeted renovation, technology is playing an increasing crucial role in shaping the future of healthcare delivery. In this series, we explore how to successfully integrate leading-edge technologies and processes to enhance patient care, optimize operational efficiency, and drive positive ROI. My name is Greg Malkery. I'm the Managing Director at Spyglass Consulting. I'm also the host for this series. Joining us today is our guest speaker, John Elms. John is a respected serial entrepreneur with a proven track record in the telecommunications industry. His in-depth knowledge and understanding of technology trends and their applications in healthcare makes him an invaluable resource. John, welcome to our webinar. Would you like to introduce yourself and provide a few opening remarks?
Sure, great. Thanks, Greg. For decades now, companies like mine and others before and since have sought to make clinical communications and the related workflows streamlined, safe, and effective. Yet today, in 2024, our doctors, our nurses, and ancillary staff are burning out at alarming rates, many choosing either to leave the profession or planning to leave the profession. We need to unlock the secrets to getting this right before it's too late. And I'm happy to be able to share some thoughts and ideas with you about that.
Great. Now, before we dive into today's discussion, I want to express our gratitude to our valued sponsors who made this webinar series possible. We have Lars Anderson from Started Systems, and we have Keith Washington from Simplify Medical. Lars and Keith, could you please share a brief welcome, tell us about your companies, and why you're excited to be a part of this webinar series?
Yeah, thanks, Greg, and thanks, John, for joining us today. My name's Lars Anderson. I'm Director of Sales and Marketing with Storage Systems Unlimited. We're a firm based on the south side of Nashville that works with all different types of facilities on renovations, new builds, as well as relocations for pretty much every department in a hospital. And obviously communication is key. So when planning, it is important to incorporate some of the concepts I know John's going to be sharing today.
Yes, and this is Keith Washington. Thanks, Greg, and thanks, John. Simplify Medical, we design and manufacture cart-based mobile computing solutions, workstations on wheels, a variety of technology, point-of-care technology equipment for hospitals and health systems. Really excited to learn about communications in the hospital and bringing communications together. Our hardware usually is an important piece of that whole communications ecosystem. So really excited to be here and looking forward to John's talk.
Well, during today's webinar, we're going to delve into the evolving landscape of clinical communications and workflow orchestration. Our agenda today includes pinpointing some of the current hurdles associated with existing communications tools and processes. We're going to be offering insights on effective strategies for designing and implementing these systems. We're going to be exploring the potential of next generation solutions, and finally providing some actionable guidance for health IT and informatics professionals on managing large-scale deployments. So with that, why don't we kick things off, John? Maybe you could tell us a little bit about your current role.
Sure. Thanks, Greg. As you know, I left Tiger Connect last year following their acquisition of Critical Alert, and after fulfilling my obligations to Tiger Connect as a result of that acquisition. In the subsequent months, I have been advising companies in healthcare IT, largely in the areas of diagnostic imaging and telehealth, and helping them move from product development into operational execution. And as you might imagine, I continue to lend my expertise and my experience in alarm management and clinical communications to would-be investors and other entities in this space.
John, how does this align with your mission to transform care team communications and workflow orchestration across a variety of different care settings?
Greg, I think that, as I said just earlier, that there is an incredible amount of burnout happening within the provider space, doctors, nurses, ancillary staff, and much of that brought about through the implementation of electronic medical records and in acute care, principally Epic. And the fact that there is an awful lot of information being conveyed to those providers, but because of HIPAA, that information is conveyed in such a way that forces those providers to go hunting and pecking, if you will, for that information rather than being presented proactively, if you will. So the idea that we can allow providers to know information they need to provide better care proactively, as opposed to alerting them that there's information they need to go look for. I think that's a really big determinant in the issues that are going on right now in healthcare communication.
John, in your experience, what are the biggest pain points that care teams face when it comes to communications and collaboration of point of care? And secondarily, are there any specific obstacles that you've seen that create challenges for effective team interaction and information sharing?
Well, sure. Look, the HIPAA regulations force us and our communications to be less obvious, if you will, than they might otherwise need to be. And that forces care teams to, as I said, hunt and peck for the information that will inform the decisions that they need to make. The Joint Commission has for years said that 70% of medical errors, unintended medical errors, are the result of poor communication between caregivers, families, and the staff. And if those communication errors can be mitigated, we can reduce the number of errors and the harm that's being caused to patients in our care.
I think a lot of your points really do hit the mark. There are a significant number of deployment challenges for care team communications, and I do think there's a very significant importance on device and system integration, workflow optimization, and platform federation. Also, a lot of recent conversations we've had with healthcare organizations also reveals another issue around the complexity and fragmentation caused by nurses managing or handling multiple devices and the proliferation of multiple computer screens within the patient room. Obviously, this leads to information overload and increased cognitive burden. John, when designing and deploying unified communication systems, what are the top priorities we should keep in mind to ensure that the system meets the needs of the clinical team and enhances patient care?
Sure. So Greg, when I look back at my time in this space, 2014 was a defining moment, right? It was at that point the Joint Commission came out and issued their national patient safety goal that said we have alarms that are poorly configured or planned, I guess I'll say, and that patients are being harmed. So in 2014, the National Patient Safety Goal said, you need to have a plan for medical device alarms. And there was this famous study that happened, and I believe it was at Mass General, where a nurse turned off the audible alerts to a certain alarm that was being triggered. And rather than change the way in which we conveyed those alerts, we just made the system such that you couldn't turn them off. So we weren't addressing alarm fatigue or any of those sort of things that were causing caregivers to be overwhelmed by these audible alerts that were going on. So the National Patient Safety Goal in 2014 said you need to have a plan, and by 2016 you need to implement that plan. So here we are, almost gosh, a decade later, and yet we're still being overwhelmed by these alarms and these alerts. And yet we have a plan, we have an alarm management committee, but when I look at, for instance, Elon Musk and the electric vehicle market, what Musk has said is throw away the things you know, create a new set of rules, continuously improve on what you know, what you change, and what you do. So the National Patient Safety Goal said, create a set of protocols for what you do with alarms, but it didn't say that you need to do a continuous improvement on how you handle those alarms and alerts. And I think that's the big challenge today, that we have a mandate to know what we're doing with medical device alarms, alerts, and communication of those alarms and alerts. But at the same time, we're not necessarily going through those protocols and continuously improving them.
Do you want to comment a little bit on maybe some of the advancements in alarm management, in particular around dynamic routing, leveraging analytics? How could this help support us in advancing patient care?
Yeah, sure, Greg. As I think about where the market has developed, back in the early days, let's say 25 years ago, there were two companies. There was Connexol in Canada, and there was Emergen in the United States. Emergen was acquired by Philips in 2007. After that time, Connexol moved into the United States beginning in 2010. And today, in 2024, Connexol is largely the dominant provider of alarm and alert management that is not otherwise captive to a medical device player. Extension Healthcare was created and has been acquired by Vocera. Critical Alert had their own alarm management product, which has been acquired by Tiger Connect. Ascom has their own product in the Unite platform. But in the end, there's not an awful lot of independent leadership other than within Connexol that's not captive to a device manufacturer. And those device manufacturers, by and large, want to control the workflows. And those workflows are largely determined by who needs to know information, how do they get it, on what platform, and when is it delivered. And Connexol, as I said, is, for the most part, the only independent provider left in the market today. Others are captive to device manufacturers who have their own unique needs for conveying information about the physiologic data that they are collecting.
Well, as you've been involved in this marketplace for nearly a decade, are you seeing that there's a widespread standardization of alarm management and the tools to improve patient care, or are we still kind of a work in progress?
I think it's still largely a work in progress, Greg. I think to the extent that HL7 and standard protocols are being implemented among the device manufacturers, it will make things easier and it will make things more effective for communicating information. Again, back in the early days, 25 years ago, the only use case really was communicating nurse call events to mobile caregivers on their mobile phones. And those mobile phones were, for the most part, replacements for what was in-building paging for nursing. So in the day, nurses had pagers. They were then equipped with mobile telephones so that they could receive events and communicate with other providers, physicians principally. But for the most part, the use case was just nurse call. And over the years, things such as physiological monitors, pulse oximeters, other kinds of events were being transmitted to those devices. But in the end, the electronic medical records and their secure messaging, they will dominate this space.
Now, I know we talked offline about some of the best practices in terms of automating things for alarm management. Maybe you can comment a little bit about redesigning processes before automation, or even how we might better align or involve frontline nursing staff.
Yeah, 100%, Greg. What I have seen during my years in this space is that there is a move to automate that which is already present, and there's a need for us to rethink, for caregivers to rethink, and I'm thinking not nursing leadership, but the staff nurses, the folks that are in the field, already addressing the needs, to redesign the ways in which we communicate with one another, the information we communicate to one another. And the idea that, I've seen for years where nursing leadership would say, let's escalate to all hands if an event is unresponded to. Well, that takes about half of a shift for the staff nurses to say, I'm overwhelmed, stop sending me these alerts, think more carefully about what we do, how we do it, and what means we use to communicate with one another. So rely on the frontline team to design that which is important for communication, how we communicate, to whom we communicate, and then continuously improve. That to me is the future.
Awesome. John, considering the rapid emergence of innovative solutions, how do you foresee the next wave of healthcare technologies transforming care teams so they can communicate, collaborate, and better manage their workflows?
Greg, I think that the holy grail in that regard is federation of the various communication protocols. Today, Epic is dominant in acute care. Epic does not federate with other communication protocols. So if you have Epic Secure Chat, you can communicate with your providers who are licensed to utilize the Epic application. But the folks that might have another communication platform, whether it is Vocera, Tiger Connect, Simpler, whomever, ASCOM, if they're not federated, they're on different platforms. So when I think about that, could you imagine as a cell phone user, me, I'm a T-Mobile account holder, if I couldn't text my family members who are on Verizon accounts, how does that work? So the idea that we have communication protocols that are not federated, I think that's a major gap in healthcare communications today that needs to be addressed.
I totally agree. John, I think a lot of your insights are spot on, especially on the role of the EHR in advancing next-gen communications. At least a lot of the organizations I've talked to, larger organizations, are actually embracing Epic Secure Chat, which really highlights the value and benefit for tight integration for communications. With conversations I've had with CIOs, they believe that this simplifies the technology landscape by merging communication channels, streamlining the flow of information, and reducing the cognitive load on care teams. Additionally, and I think this is really interesting, many healthcare organizations I've been talking to are really want to see the integration of Epic Secure Chat and Microsoft Teams in order to connect clinical and administrative communications. And there's some logical reasons why this makes sense, because they already have their existing enterprise licenses for both platforms. I'm just not clear from my conversations whether they fully understand what that's going to look like in the future. I don't know. Any thoughts on that, John?
I do. Greg, I started in healthcare communications back in 1999 when I joined Spectralink, who at that point was the leader in voice communications within healthcare. And what I've seen since is there is domain expertise that is resident in areas that are surely not located in the electronic health record market, right? So there are domain experts like Tiger Connect, like Vocera, like Spectralink, that understand communication among providers that perhaps have not been adopted or embraced by the software companies that have added communications to their electronic health records. I think there's a real opportunity for the Cerners, Allscripts, Epics, and others in the world to really understand communications better than they do. Otherwise, they're offering a solution that's good enough, but not necessarily best of breed.
Great, thank you. John, as healthcare organizations embrace new technologies, what are your recommendations for healthcare leaders who are navigating the deployment of next generation solutions to empower their teams and to help optimize patient care?
You know, Greg, it really comes down to understanding the needs of the frontline staff, and for an IT organization to decide best practices without clinical collaboration, I think that's just folly. I think that understanding the needs of the frontline staff is paramount in designing and deploying.
John, I agree with your points. I think for effective integration with assets, the current digital assets, health IT leaders must more closely align and work with the clinical informatics to understand the workflows and the data flows. And sometimes that's not totally apparent. I also believe that it's critical for health IT leaders to seek scalable and adaptable solutions for widespread deployment, as many of these larger health systems now are trying to standardize, across 50, 60, 70 hospitals. So I think that's pretty significant. Well, John, I want to thank you for sharing your insights today. A lot of our discussion aligns closely with Spyglass's latest study on digital patient engagement. Our report uncovers a lot of the market trends driving investments in usage models. It identifies opportunities and challenges for supporting large-scale deployments, and suggests how healthcare organizations can leverage digital tools to prepare for future healthcare delivery. To learn more about my report, you can visit my website at www.spyglass-consulting.com. Well, thank you for joining today's webinar, where we discuss the changing dynamics of care team communications and workflow orchestration within various healthcare settings. But before I wrap up, I have a couple polling questions and would appreciate if the audience would respond in the comment section below the video. How do you rank the following on a scale of 1 to 5, with 5 being the highest? How would you rank the quality of your organization's overall patient engagement initiatives and programs? And the second question is, how would you rank your organization's investments in digital patient engagement tools and technologies? So if you guys could take a couple of minutes to put that in the comment section, that'd be greatly appreciated. Well, I'd also like to thank our guest speaker, John Elms, for his time and insights. John, do you have any closing remarks on our topic today?
No, Greg, I think that when we look at our provider community, physicians, nurses, ancillary staff, and we understand just how overwhelmed they are with communications and poorly designed communication strategies, it really argues for a major rethink of how we're communicating with folks and asking them to communicate with one another, their patients, their payers. there's an awful lot of work that we need to do, and if we fail to do that, we're going to lose an awful lot of really caring, qualified individuals providing healthcare in this country, and we owe it to them to do better.
Great. Thank you, John. Well, I also want to thank our sponsors, Storage Systems and Simplified Medical. Lars and Keith, do you guys have any final thoughts?
Yeah, thanks, Greg. I can relate to the burnout that has been felt by the medical industry. I actually had my own burnout case a couple years back in the investment world, and decided to make a career change. So it's been interesting learning the aches and pains of health systems. The ever evolving technology. What worked 5 years ago is probably considered an antique today. So making sure that you have the right partners that have products that are looking towards the future and anticipating what's to come, I think is very, very important for communication, the supply chain process, and when we're incorporating it into design planning.
Yes, Greg, this is Keith. Well, I really appreciate John's insight, and I think a lot of the problems that he's identified is part of what we're reaching for and Beyond the Blueprint, which is to step back and take a look at the design aspects of putting all these things together in a way that really benefits more of a patient-centric, value-based care model. And so, I think just listening to John taking away the kind of the fragmentation and the disparity, it just would call out to vendors to work together on a more collaborative basis. And, the more federated approach that John mentioned, I think that's very insightful, and really appreciate that perspective, and really hope that in the future, John will come back and maybe we can talk about more examples where, some of that actually worked out for the best.
Well, thank you again, Keith and Lars and John. We look forward to continue our conversation during our next scheduled episode of Beyond the Blueprint.